Children's Hospital in the Heart Center for 6 years. Last year, the Heart Center performed 21 transplants, and in 2011, they set the national record for 31 transplants. I knew transplants were my favorite kids to take care of because on my first day of work, I watched a 4-month-old baby receive a new heart. It was a miracle. To watch this lifeless heart be placed inside this little boy's chest and then start beating was absolutely amazing. There are 2 types of transplant. There is orthotopic and heterotopic. Orthotopic is the most common and is what we do in the Heart Center. That is where they take the old heart out and put the new heart in. With heterotopic, they actually place the new heart in the chest right next to the old heart, so the patient's left with 2 beating hearts. And this is also known as a piggyback transplant. The reason they would do a heterotopic transplant is for a patient that has extremely high blood pressure before transplant. They can't take the old heart out and put a new heart in because that new heart would fail with such high pressure. So they put the new heart in next to the old heart and they can help each other out and relieve pressure from one another. Heterotopic is very rare, and there's only been 9 documented cases in the United States where they've performed a heterotopic transplant. Transplant is not a fix. It's trading one set of problems for another. So once it's determined a patient needs a heart transplant, several things must take place. First, they must have a thorough examination, making sure there's no pre-existing illnesses that rule out transplant. And then they must have several labs, CT scans, and heart caths performed. After that, dental, social work, dietary, and pharmacy must consult with the patient. And if everything checks out, then the patient can be placed on the transplant list. Sometimes these kids wait for just a few hours or months and months. I've seen children who haven't even had to wait on the list for 24 hours. And then I've seen kids who have sat in the hospital for months upon months waiting for a new heart. Occasionally, these kids can actually go home and wait for a transplant, but that's very rare because usually by the time they need a transplant, they are so sick that they need to be in the hospital on continuous IV heart medications. So that you get the call and now you have a transplant. Now what? So the patients are on bypass for several hours, sometimes 12 hours or more. With this, you can often see multi-system failure. So the heart pumps and feeds all the other organs, and if that new heart isn't pumping efficiently, then you have a high risk of other organs failing. The most common things that we see after transplant are stroke and kidney failure. Most of these patients are so sick that we require at least 2 registered nurses to be at their bedside for the first 12 hours. Usually it's the first 24 hours, and sometimes I've seen as many as 4 nurses and the doctor at the bedside the whole shift. These patients you can expect to be at the hospital for a minimum of 2 weeks, but usually that's much longer. Transplant patients will be on medications for their heart for the rest of their life. They will go to clinic visits regularly. At first, they will go every week to have labs drawn, and then it'll space out once those labs are stabilized. And they'll also have yearly biopsies to make sure their heart tissue doesn't have any rejection. So transplant's not a perfect answer, but it does buy time for these patients. Transplant drugs can cause diabetes, infection, kidney disease, cancer, and high blood pressure. Women are advised not to have babies after having a transplant because these transplant drugs can cause detrimental effects to the fetus, and then a new heart doesn't have the strength as what your original heart does. And a pregnant woman has pregnancy causes a lot of issues to the new heart. So after a transplant, patients are required to have multiple surgeries sometimes. Sometimes they need new valves or other things done to their heart. Usually after a heart transplant, a patient can only expect to get 10 to 15 years out of their new heart. So what that means is they'll probably go into heart failure, and then they'll either be listed for a new heart at that time if they're a candidate, or they will die. The organ procurement and Transplantation Network says 27 people are waiting in Arkansas. Donor and recipient information is kept private. Aurora says, "We don't know where the organ comes from, but there are ways for the family to find out later." So, Aurora allows patients to actually write letters to the family through their organization, and these families can be connected that way. So Aurora also states that the 1-year survival rate is now almost to 90%, which is up from 81% in the early 90s. The first transplant was in 1968, and we've come so far since then, and I'm excited about what the future holds for transplant.